technologies from drones to apps and even computer-controlled vending machines are helping to improve healthcare and provide access to vital medicines for many people in Africa, despite the poor health infrastructure. Our guests, Tunde Jegede and Kazim Lawal, are tech entrepreneurs working to elevate the health tech sector in Nigeria with their new app, AXOCHECK, and they're here to tell us all about it. Welcome, gentlemen, to the morning show. Thank you for joining us today, and good morning.
Good morning. Thank you for having us.
All right.
Good morning. Thanks for having us.
Right. As you heard in my introduction, healthcare in Nigeria is conspicuously underperforming. Now, I understand that you both are based both locally and in the diaspora and have released this new app designed to support preventative healthcare in the Nigerian healthcare system. Now, walk us through the program and how the app works. Let's start with you, Tunde.
All right. Again, thank you very much for having us today. Based off of your questions, we were based in Nigeria and both in the diaspora as well. What has happened over the past few years for us is the movement between both ends of the world for us has given us the reason to see how things work elsewhere and the need for us to give back to our own immediate society. And as such, myself and Kazim and a third partner of ours, Benga Sholademi, came together sometime last year to develop a solution in the tech space called AXOCHECK. And immediately we came up with AXOCHECK. It's a solution that strives towards preventive health in Nigeria. The idea for that is that we want to catch problems in our health space before it becomes a big deal. Okay, so for us, it's a fight to give back to the society in the space of health, catching it fast before it becomes a big problem, and also using technology, as it were, to help solve the many challenges that we see that plagues the Nigerian health sector, as it were.
Thank you very much. Well, Kazim, I wonder if I can ask you, your thoughts. This app, AXOCHECK, definitely seeks to solve problems, but it's definitely operating in a climate where there are many problems, one of them being a shortage of medical professionals in the first place. A huge host of the Nigerian doctors registered in this country here in Nigeria are actually practicing abroad. So does that affect your ability to successfully roll out this, what seems to be, doctors or medical professionals, freelance medical professionals, being able to go to people who need them through this app? Isn't it difficult to operate with the shortage of doctors that we have here in Nigeria?
No doubt. There is a concern in terms of the professional health folks that we have in Nigeria. However, I think this is one of the value propositions that AXOCHECK provides. It gives us the ability to scale, right, those healthcare professionals through some sort of a mix between, it's more like a hybrid between telemedicine and leveraging our great registered nurses to go out and actually visit these clients in the home, and then giving the clients the ability through the app, right, to also talk to medical doctors out there. So it's a good mix, and using technology has been critical in helping us to scale, right, the access of these professionals to our clients and to Nigerians back home.
Well, Kazim, you just talked about technology. Well, in the urban areas, it can't be compared to its operation in rural areas or suburbs. Most times, proper healthcare is unavailable to low-income earners and the poor masses, of course. What methods are you looking at in bridging this gap?
Yeah, that's a great question, right? To that end, we've really put in place what we're calling a community health focus, where we go out into the communities, into those urban areas you refer to, and really drive the health focus out in the communities through some sort of a scheduled cadence. We believe that's the way to go forward, having those healthcare professionals in the community and providing that support. Awareness is critical, and folks being able to talk to those professionals would help bridge that gap.
If we put that same question to you, Tunde, also about access, I mean, it's no secret, Nigeria is vast. There's a whole lot of people running around this country, and they're not all just here in Lagos. They are definitely spread across all of the different parts of this country. So again, I want to put to you how you think you're readily getting more people involved and making sure that people aren't priced out of quality healthcare, even if this is a business seeking to make profit?
Yes, thank you for that. I'm going to delve a little bit further into what Kazim said. For us, we have beyond making money with this. Yes, I mean, we've gone into this to make some money for ourselves as well, for our family as well. But for us, it's way beyond that. Like I said initially, it's about giving back to the society for us. So we have a social impact arm to this, and we already have partners that we are speaking with in Nigeria. The plan, like Azim says, is to go into the rural areas, core rural areas, where we know, for instance, that the people in those places actually do not have access to technology, as it were. So the plan is to have our health care professionals, our nurses, go into those places, okay, and based off of a calendar, based off of a pre-planned schedule, we go into those places and we could have a whole village in a week. So the idea is that we are not leaving anyone behind. Now, your question, the second arm of your question is pricing to this. Well, the plan we have is that there are many NGOs that give back to organizations such as ours. The plan is to reach out to those bodies. When we reach out to those bodies, the plan is to show them that, oh, you can support a village, you can support a town, you can support a cause, okay? So once we get that rolling, and I mean, when I say once we get that rolling, it's already in the plan, it's already in the works. We're just waiting to implement a few of them within the next couple of weeks.
Right. No, you said that you have teamed up with the best nurses with world-class training, according to your website. Now, how were you able to determine the proficiency level of these nurses on your platform? And do you have parameters that determine the nurses you employ?
Yes, thank you. So one of the first parameters we've put in place is nurses that are fresh out of school, we do not allow onto our platform immediately. There is an experience level to which we would expect a nurse to have. I mean, this is health. It's not something that we're just going to joke around with people's health. Okay, so that's the first step. The second step for us in ensuring that the level of nurses we have are some of the best is that we've gone into partnership with the Nigerian Nursing Council, which helps us to whittle out nurses that are not licensed. So we really want licensed nurses. The third step is to ensure that we also put on board nurses that are currently practicing. So it's one thing to have a license, it's another thing to actually be practicing the profession. And then one of the final steps we've put in place is that we ensure to carry out what you call an examination of the nurses. So before we onboard a nurse on our platform, the nurse would have gone through various steps and processes that we expect them to show. For instance, when a nurse applies to get on the AXOCHECK app, a doctor gets on a call with the nurse. There are vital questions that the doctor would be asking the nurse that shows to us immediately that, oh, she has a hand or he has a hand of the profession. And as such, we're able to generate some of the best nurses and put them into this space for us.
And can I ask you, Kazim, how deep it goes in terms of the power these medical professionals would have to identify any type of medical health problem? Are they able to prescribe any medication? Do they administer any medication? And then still on the topic of pricing, I know we've taken a quick look at your subscription prices, and they range from around, it's 10,000 Naira, roughly around $20. You'll forgive my exchange rate. Around $20 a month, some $100 for 6 every every 6 months. And then if you want to go for an annual subscription there, it's around $200, around 100,000 naira. Again, my numbers are a bit shoddy. That being said, I just wanted to speak to you once again about how deep it goes in terms of your medical professionals speaking to patients. Are they expected to prescribe medicines? Are they expected to administer medicines? Or is this just checkups? And then separately, again, subscription. How does that work? What is that money for? Is it for medication or is it for access to somebody coming to check you out?
Yeah, I think the answer is all of the above, right? So just to kind of work you through it, what happens in the scenario is this client or our customer out there has access to a nurse that will be in person to make sure they come out and check all the vitals, ensure that they can physically see how that client is doing, ensuring that they are interacting with the client. We understand that there is still a level of personal touch that is required to really get the best solutions out there. Then you have, as we mentioned, you have your doctors out there from a telemedicine perspective that would also speak to the client and also be accessible to the client, as it were. And to your point, you also have, or the client also has access to the fact that we can prescribe medications as needed. And more importantly, also access to us to refer them to specialists as needed. So it's an end-to-end process. But I think the key message here is, how do you get in front of your healthcare? How do you get in front of your health? We believe getting in front of it is the first step to a better life, is the first step to ensuring that you're not paying exorbitant costs, to ensure that you're not paying exorbitant costs in the long run. So it's $10,000 naira a month, which helps you get access to a doctor at any point in time that you need. A nurse will visit you once a month. And you also have the ability to get prescription, or we'll get a prescription order as needed.
Right. I wanted to find out how successful your app has been so far since you guys released it. And I know that you guys are also targeting the elderly. Now, how easy and how difficult is it to use this app for the elderly?
It's a great question. We took painstaking measures to ensure that it is very simple to use in terms of how many clicks, how it looks, the language that we're using, and quite frankly, in ensuring that it's one that brings out the best in terms of what we have to offer. And I think it's also, we'll be remiss if we did not mention that Nigerians are very, very digitally savvy. Nigerians are very, very digitally savvy. So in our customer experience research work that we've done, we're finding that it's very user-friendly. We've had a lot of great feedback from our clients already, thanking us, appreciating the work that we're doing. And that's what really drives us every day to go even further.
Indeed. And to Tunde, to bring you into this conversation here, again, if we are talking about, as OG rightfully put it, if you're talking about speaking to vulnerable members of society, definitely the elderly, a question about how user-friendly is valid. But in addition to that, if we look at the current medical climate we are in, we are definitely within a pandemic. What type of protections are in place to not only protect your medical professionals going into different homes, but definitely keeping people safe there as well? Very briefly.
Yeah, good, solid question. In fact, if you didn't ask me that, I was going to bring that up. So one of the main reasons why we actually decided to quickly go into the market, as it were, was because of the pandemic, as it were. So what we found is that a lot from research, a lot of the elderly folks are averse to going into a hospital setting right now. Too many people, too many risks of getting infected and all that. So what we've done in essence is to ensure that our professionals, when they go visit anyone, and it's not just the elderly, right? It's not just the elderly. So by the way, let me just point out that our solution is not just targeted at the elderly.
Gentlemen, I'm so sorry to have to interrupt you there. Tunde Jegede and Kazim Lawal, thank you very, very much for your time on this. Those are the co-founders of AXOCHECK. Thank you very much for your time. We've enjoyed that conversation.